Your ability to communicate well with your physician and your medical team is absolutely critical as you're making treatment decisions with advancing illness. But this isn't easy. It's difficult to ask the questions, but if your physician doesn't know who you are, what you want, what your goals and limits are, he or she is going to assume you want everything done, regardless of whether it may be the best interest for you or not. So being able to ask the questions is critical. But now how do you do that? You're coming into the doctor's office, you've got 15 minutes, and sometimes the ideas go out the door, out the window. So there's a couple things you can do to prepare. One is bring people with you. All the extra set of ears you can get, extra questions, everybody can hear a piece of that. That really helps everybody be on the same page and understand the treatment plan. Record the conversation, because it's very difficult to remember what all has happened. As a human being, we are lucky in optimal circumstances to remember 70% of anything somebody has to say to us. If you add a little bit of discomfort or fear, that drops down to 40%. So you can imagine if you're being faced with a conversation that is such emotionally laden as talking about end of life, the ability to hear can go out the window. I have a very good nurse friend of mine. She's been a nurse for 45 years. Her husband is a physician, so they are very knowledgeable. And she said, you know, when the doctor came and sat down with me and told me I had stage 4 breast cancer, after that moment I heard nothing. I know she went on to tell me about all the treatment options and positive information, but not only could I not hear her, I didn't have the ability to say, stop. I need time to absorb this. Let's talk later. So in recognizing that, give yourself breathing space. Make another follow-up appointment to say, let's go over again what you had told me. I now have new questions about that. Give yourself time to do that, because there's no way you can remember everything. And it's not that you're in denial. It's not that you're cherry picking. It's as a human being, it's hard to hear it all. Another helpful technique is to prepare your questions ahead of time. There's a downloadable list of questions available on this website that can help guide you to looking at what are the most important questions that you need to have answered. Put your top 3 on the top to make sure that they get responded to. When you call the physician for the appointment, let them know you really want to sit down and talk about treatment options, because that may afford you a little bit more time in the office to field all of the questions that you may have. Then be sure to reflect back on what you heard, because it's not easy to always understand some of the terminology that we end up using. So you can say, okay, stop there. This is what I heard you tell me about the treatment. And then give them the chance to either say, yes, that's exactly what I said, or no, let me give you some more information. Because the language barrier can be a real issue at times. We use terminology that are not comfortable with for you. And sometimes folks want to be a good patient, and so they'll nod their head. I've certainly done that with my high techno-geek friends. I don't understand anything that they're telling me, but I'll nod their head because I don't want them to see how stupid I am. But this is about your life. If we're using a term that you don't understand, stop us. Get the clarification, because you might be making decisions based on misinformation, and that would be really difficult. The other thing you might want to consider is the fact that it may be difficult for your physician to talk about end-of-life issues for a couple of reasons. One, they may not have had the training and therefore are uncomfortable. 2 is that they may sense it's a sense of failure on their part, and they don't want to fail, so they want to keep treating no matter what. Or 3 is that they're waiting for you, because physicians also get attached to you, just like your family members do. And it's actually harder for the physician who knows you well to kind of identify that point where you're kind of cresting in your life. And so they're actually waiting for you to say, Doc, I need you to give it to me straight. You know, what is the benefit and the burden? What are we talking about time? Would you recommend this treatment or not? How is it going to affect my quality of life? How is it going to affect my length of life? Now, it might be you don't want that kind of information, but your family will need it. So it's okay also for you to say, you know what, Doc, don't give me any bad news, but my daughter over here, talk with her. Give them a way to communicate so that we can ongoing know what's going on in the family and afford the best possible options for you. For more information, you can visit my website at passageseducation.org. There you'll find my list of free talks that you can attend or request one for your own group. You can schedule a consultation, or you can find some helpful resources.